Okay, our last section here is physical therapy and rehab. And the reason I want to talk about it is really just that you can work in the rehab setting. A PTA or physical therapy assistant is much more qualified, but there's a few things you guys do that relate to this. So this is a very short section again. So there's just a few key elements that you really need to be aware of for this PT section. So we're really just looking to help patients actively perform what we call the activities of daily living or their ADLs, and help them to physically be able to perform better in their life. You guys are going to watch a video on proper body mechanics. This is something that most of us knew. We sort of previewed this in some previous weeks, and you did a class. This is your last checkout. So please watch the separate video on just how to lift something properly when it comes to body mechanics. So your posture, keeping your body straight. Standing, your body should be balanced. Sitting, your spine should be in a neutral position. You may want one of those little lumbar pillows for the back, and that will be very helpful in terms of body mechanics. When lifting, you want to make sure that you keep your back straight, your feet shoulder width apart. We are always bending from the hips and the knees and not just pivoting down and keeping our legs straight and bending at the waist. It puts an enormous amount of pressure on the low back, which leads you to potentially injure your low back, rather than bending with your knees, which uses your bigger muscles in your glutes and your legs to effectively lift an object. And always use carts to push or pull heavy objects. You shouldn't just be push or pulling them through hallways and other. If something is really heavy, make sure that you get help. And in fact, when you're doing your patient lift today, you should be doing a 2-person patient lift. That is always the ideal way to do it. If you need to wear those little belts around your waist or put the gait belt around the patient, we'll do that during the last week. And then just making sure your path is clear. You don't want to trip on something that's obvious. So again, just a recap, use the large muscles, get close to the object or the person being lifted. So you're going to watch a video next on how to do the lift. You're going to do a very quick practice on that. There's just one other thing I want to go over before we're done with just some of the content here, to make sure that you are all set for concepts needed for the final exam. So one, just making sure that if you're walking with a patient who is unsteady, patient should be wearing good shoes, flat, supportive, rubber so that they don't slide on things. Make sure they walk with a cane or a set of crutches, hold on to railings. Gait belts are those little belts that you place around and they have a little portion that you can hand hold onto to help you support the patient. So if needed, please use those items. They should be provided. If they're walking, they're unsteady, just stay with the patient. Don't push them. Don't hurry the patient. And then just be ready with perhaps a wheelchair. You are not to catch a patient's full weight if they start to fall. You're only going to injure yourself, but just do your best to eliminate serious injury to the patient. All right, you're also going to watch a little video on crutches and a video on canes. We're just going to do the activity in class right before the final exam. Very, very straightforward. So it's just a group activity. So we'll make sure we go over this again, but you'll be watching these 2 videos next. So walkers are all 4 points. They provide stability. They can have the wheels or they just have all 4 with the rubber caps. The stationary are actually a little bit better. The rolling ones can be a little bit dangerous for people who are not steady and don't have good arm control because as it pushes out in front of them, we don't want them to go down and have it roll too far away and down they go. When you're fitting a walker or a cane, one of the biggest things is you want to adjust the height. And so you want to make sure that the elbow is about a 30-degree angle in the bend when you're adjusting for the full height. And we're going to practice this. It's just a practice activity for the very last week, just to make sure you've got what a 30-degree angle looks like for your patient. Crutches, I'm going to save the crutches. Please watch the video. It's great. They're pretty funny. You're going to really enjoy it. And canes are very similar in terms of being adjusted like a walker. So you do want to adjust the cane to about a 30-degree bend in the elbow. But this is a little bit less assistance. So it's really just weakness in one joint or one side of the body. And you just need a little bit of assistance moving forward. So the last thing we're going to talk about is heat versus cold. I just want you to have an idea about what these things do. So heat or thermotherapy causes vasodilation, or those blood vessels to open up. It causes the blood flow to come down to the injured area. It helps to relax sore and tired muscles, right? So it's just one of those things that, if you've got some achiness, um, heat is probably a great thing. One of the things you want to just be aware of is that whether it's heat or ice, 20 minutes max is the absolute longest time you should leave heat or cold on. If you go past that, you actually are going to create some damage to the tissues underneath, and we don't want to do that. The other thing you want to be cautious of is if you're placing on a hot pack or a cold pack, is just that it can actually burn or create some damage to the surface of the skin. So making sure that you put some toweling between those things, instructing the patient to let you know if it gets too hot or too cold. And then making sure that you stay available, right? We don't want to create burns, right? Because somebody doesn't say something or that you just walk away and, the patient can't get it off their body. Cold or cryotherapy does the opposite of heat, right? Whereas heat opens up the blood vessels, cold shrinks down the blood vessels. So it helps to slow inflammation, bring inflammation down. It also numbs the surface level nerves, which helps to reduce pain. So cold is really great for excessive swelling, whereas heat is really best for things that are more achy in nature.